You probably already know that October is Breast Cancer Awareness Month, but did you know that Black women are more likely to die from breast cancer than white women? So more progress needs to be made to improve outcomes for Black women with the disease. These improvements can start in the early days after diagnosis by ensuring that they have access to reliable, clear, and accurate gene expression profiling. So joining us to discuss are Dr. Sonia Reed and breast cancer survivor Alicia Saunders. Thank you so much for joining us today. And Dr. Reed, we'll start with you. What is the current state of breast cancer rates, and why is there such a disparity in treatment?
According to the American Cancer Society, approximately 300,000 women will be diagnosed with breast cancer this year. And while breast cancer incidence rates among Black and white patients are similar, mortality rates are very different. Black women are actually 40% more likely to die of breast cancer than white patients. And there are many reasons for these disparities, including complex socioeconomic factors, access to care, but differences in biology also play a very important role.
And so, Dr. Reed, can you tell us more about this gene testing?
Yes. So there are few available genomic testing that's utilized in clinic to guide discussions around chemotherapy benefit. And what essentially happens when a patient has breast cancer, especially hormone receptor positive breast cancer, to just be a little bit more specific, their tumors can be profiled with these gene expression profiling to essentially determine whether that patient has a higher risk of recurrence. And based on that information, that patient will then be offered chemotherapy for their higher risk breast cancer, because we know that will ultimately impact their outcome in the long run.
Alicia, over to you. We mentioned you're a breast cancer survivor. Can you tell us a little bit about your story in surviving breast cancer?
Absolutely. I was 33 years old when I was diagnosed, and I was actually expecting my first child. And surprisingly, I had no family history. So with that information, my oncologist ordered an oncotype test to be conducted. And when he received my results, it put me at a higher risk for reoccurrence. So his suggested treatment was chemotherapy as well as termination of the pregnancy. That just didn't sit well with me. So I opted to seek a second opinion and met with a doctor who had just returned from a medical conference where he learned about the MammaPrint test. He did the same thing, sent it off, and my scores came back, which put me at a less than 10% risk for reoccurrence. And that in turn changed my entire treatment plan. I was able to forego chemotherapy as well as proceed with having my oldest daughter. You know, reflecting on it, I always say I'm proud of myself for advocating for my health, for doing my due diligence with seeking additional opinions. And that's the message that I typically try to relay when I meet other breast cancer patients, is I let them know you are your biggest advocate. So don't hesitate to do the research. Don't hesitate to learn about different genomic testing, inclusive of MammaPrint, because surprisingly, many have not heard of it. So, you know, I tell them, do your research, present it to your doctor, and you and him can come up with the best treatment plan. But just make sure you always advocate for yourself and don't hesitate to seek other opinions.
Alicia, thank you so much for telling that story. We're almost out of time, but I do want to ask, where can we go for more information?
So for more information about gene expression profiling, including resources that can help you talk to your doctor to make sure the test being offered will work best, I would say go to agendia.com to at least start that discussion with your doctor.
Awesome. Thank you so much for joining us today. We really appreciate all of that information.